I have gotten 14,435 calls so far on healthcare. Last week, I got 85 calls all week about the shutdown. So I think I know what people are really watching, whether it be the $500 billion cut to Medicare, whether it be everyone's rates going up, whether it be people going to be kicked off of Medicaid after the election in November next year, or the very real effects in the next couple of weeks with people on the Affordable Care Act. People get what's a priority. It's their healthcare, and it's not whatever game it is that Mike Johnson and Donald Trump are trying to play.
Congressman Pocan, we've reestablished a connection with him, and he joins us now. Congressman, how are you?
Good. Living in rural America, as many of your listeners know, I'm now working off of my phone, which has got a couple bars, but it sure would be nice if we had something like rural broadband everywhere in Wisconsin.
Wouldn't it, though? Wouldn't it? I mean, and to do that, of course, you'd need a working federal budget, which is where we are at all this. So, I mean, we've gone through this ad nauseum. We've established that Republicans have the majority, and they could be doing something about this. And yet, Congressman, from Speaker Johnson, Senator Ron Johnson, and others, Transportation Secretary Sean Duffy again yesterday, working so hard to label this as some kind of a Democratic shutdown. And they can read polling. They know Americans understand who's at fault on this and that they don't believe them. How much longer do they think they can keep up this facade?
I don't know. I don't quite get their game plan because it changes almost daily a little bit on their messaging, especially at the White House level. But last week, I got 85 calls all week about the shutdown. We were getting up to 500 calls a day when President Trump was stealing funds from nonprofits earlier this year through rescissions. And this year, I have gotten 14,435 calls so far on healthcare. So I think I know what people are really watching, not the shenanigans of the Republicans trying to make some political point in Washington, but they understand that in the next couple of weeks, we're going to get our new rate increases because of the big ugly law for the Affordable Care Act. We're also getting group plan rate increases that they had to factor in that law. And, just to give you one example, I talked to an employer Friday night who said they got their new rate increases for next year, 41% increase. And we got people on the Affordable Care Act that we've been told statewide, the average for this demographic, but a couple in their early 60s making $85,000. Statewide, we'll see about a $17,000 increase next year in health insurance premiums through the Affordable Care Act because of the Republican action through the big ugly law. So whether it be the $500 billion cut to Medicare, whether it be everyone's rates going up, whether it be people going to be kicked off of Medicaid after the election in November next year, or the very real effects in the next couple of weeks with people on the Affordable Care Act, people get what's a priority. It's their healthcare, and it's not whatever game it is that Mike Johnson and Donald Trump are trying to play.
And if I can just for a moment linger on that one group that you mentioned, maybe because I belong to it, but look, we can say a lot about retirees, and we can say a lot about young adults, young families, college students, farmers. There's no shortage of constituencies, but we did have a story from Up North News reporter Selena Heller earlier this week, a woman in La Crosse who was getting rather emotional, talking about these looming health insurance premium increases because they're in the demographic of people in their late 50s, early 60s. They are too young for Medicare, and they've just been waiting and waiting to get on Medicare because they work for a place that doesn't offer health insurance, or the health insurance is completely unaffordable, or they are self-employed and they are just waiting. But in the meantime, at least we have the Affordable Care Act marketplace to get them there. But that group in particular, some are realizing how tough it's going to be. Others, like you said, they're a week or two or three away from getting a notice and getting the sticker shock of their lives.
Yeah, the 58 to 64 demographic is in the worst place. If you're on the Affordable Care Act, those are going to be some of the biggest rate increases. We've been told up to $24,000 you could see in Wisconsin. The average will be more about $17,000 for people in that demographic, but everyone is going to get that. And the other thing that I should mention, because obviously the Eau Claire area well, I was just up there, and they lost their two hospitals, 73,000 people, no hospitals. You can't even call that a rural hospital when you have 73,000 people, but it still is by definition. They, in the big ugly law, because there so many people are going to lose health insurance, that's uncompensated care. You don't not get sick. You still go to the hospital. That's going to cost about $434 billion across the country. They put a little band-aid on this gaping wound of $50 billion. They're going to cover $1 out of $9. But when you don't cover $1 out of $9, you're going to have hospitals and nursing homes closing down across the country. In Wisconsin, one of the three that's targeted is up in Osseo. It's the Mayo Clinic Oak Ridge facility up there. And, you've got people like Derek Van Orden in Congress, who recently wants to pull away all the federal funding away from the Mayo Clinic, as well as the city of Eau Claire and the village of Ellsworth and other people, because they've somehow said something he doesn't like on the internet. And, it's a pretty scary time, given, people, the most people think about, can they afford their mortgage or rent? Do they have health care for their family? Can they maybe take a family vacation? And if we're pulling away a real economic, necessity for people, it's a scary time for people.
What does it say then that somebody like a Congressman Derek Van Orden, or even the Speaker of the House, Mike Johnson, saying, don't hold these town halls? They love to tar the people, their own constituents, who are going to show up as somehow being like paid agitators or something. And so that you've gone through the 3rd congressional district, Derek Van Orden's district, to do these town halls instead. Is there any way that this works positively for people like Congressman Van Orden?
Not if they don't listen to their constituents. And if you don't have town halls, you're not really listening to your constituents. So because we had time when they canceled votes this week, my whole calendar was in Washington. So we, with about 48 hours roughly notice, scheduled 4 town halls in Derek's district, in Richland Center, in Viroqua, La Crosse, and Eau Claire. People showed up in all of them, as well as the media, because they don't see their member of Congress talking about this stuff. And I always use the Wisconsin smell test. If he really did such a good thing with the big ugly law, and this is such a good fight over the shutdown, you'd want to go to every county in your district and brag about what you did and what you're doing. And instead of doing that, you're hiding in your basement. I mean, people get that you don't have a message when that's the case. So, the rumor is now they may pull next week. We're already trying to assess, do I go into another district, or should I find 3 more communities in the Western Wisconsin district? Because Derek is obviously one of the I guess, biggest chickens in our delegation, because he's never done an open public town hall in the 3 years he's been in office. But, it's a higher hurt in the 3rd district than in my district on what's going to happen on the Affordable Care Act. When you look at the actual numbers people are going to have. And I think, people just have to understand that their member of Congress is actually giving them lies about what this is about. And I'm going around doing truth telling on it.
Congressman Mark Pocan is our guest, talking about the government shutdown. And again, their hook, if you will, is that all of these cuts that they've made are all about making sure that health care benefits can't go to undocumented immigrants. And they use just blatantly, racist lines about, if you're an American citizen waiting for, the ER, and there's some immigrant there who's going to get their health care first, blah, blah, blah. Well, first off, you don't know that that's an immigrant. They may be a citizen just the same as you, just not the same skin color. But again, can you talk about just how much of federal health care actually does go to undocumented immigrants?
Yeah, well, first of all, let me say the cuts to healthcare in general, they did in the big ugly law, were done to provide a tax cut for Elon Musk and Donald Trump and people who can afford to belong to Mar-a-Lago. So first of all, they stole our healthcare to give rich people a tax break. That's first and foremost in all of this. But their argument that this is, I think JD Vance said, hundreds of billions of dollars. We're doing this because we want hundreds of billions of dollars of healthcare to go to, their words, illegal aliens. Well, here's the reality. I serve on appropriations. I know a thing or two about numbers. By federal law, not a dime can go to an undocumented person. I'm going to use the proper terminology, through Medicaid, Medicare, or the Affordable Care Act. Nothing can go directly to someone in that area. The only little bit is in a program that was created under, what was his name, President Ronald Reagan, which is about 1% of the Medicaid budget. So 1% of one of those bigger programs budgets is money that goes to hospitals for if you go there and you don't have health insurance, they don't check your papers or anything else, you get coverage. It can work for you or I if we didn't have health insurance, or someone who may be undocumented, but that's a maybe, possibly, kind of could happen, not reality. And that's 1%. And if you don't have the money going to hospitals, Pat, here's the important part. What happens is we all pay more for insurance to make up for it.
Exactly. Congressman Mark Pocan, great to catch up with you. Thank you, sir, very much.
Yeah, thank you. Appreciate it.
Good to check in with you. Safe travels around both congressional districts.